Hello, it's Dr. YouTube here, where I upload medical educational videos. Today's episode will be all about the descending tract, in other words, the motor tract of the corticospinal tract. The descending tract is actually easier to remember than the three ascending tracts, which you can see in my other video: the spinocerebellar, the posterior column, and also the spinothalamic tract. Because the descending tract, really there's only one, which is the corticospinal tract. However, there are sort of there's the anterior and also the lateral spinothalamic tracts. The lateral makes up the majority of the tract, and it's important to also remember that the lateral fibers actually cross in the medulla. This is at the pyramids of the medulla. So if we just recall the cerebral cortex, goes from there. You have your anterior and lateral corticospinal tract, cortical, so the cerebral cortex, and the spinal is there. Your lateral fibers make up the majority of it, which crosses at the medulla and the pyramids. The anterior fibers stay the same side. So, if you have any problems up there, you will have weakness on the other side. But if you have a problem down there, then you will have weakness on the same side. So, for example, if you have a stroke, then you'll have weakness. If you have stroke on the left side, for example, you will have, because the majority of the corticospinal tracts are in the lateral one, so you will have weakness of the other side, the right side, for example. So that is the lateral and anterior spinal tract. So just to recap about the anatomy, remember the pyramids is where the lateral corticospinal tract decussate and change sides. So from there to there. So as I said, if there's a stroke up there, then you will have weakness on the contralateral side. But if it's a bit lower down than the pyramids, then you will have weakness on the same side, as you can imagine there, for example. So here I put 14 pyramids. So this is the medulla. This is the pons. And here is the optic nerve, the optic chiasm. I think those are the main landmarks that you have to remember for the brain stem. So, optic nerve, optic tract, the pons, and the medulla, and specifically the pyramids is where the decussation of the corticospinal tract, the lateral corticospinal tract in particular, occurs. I hope you found this video helpful. If you do, please give it a thumbs up, like, and subscribe. Take care and look after your tracts.